So, good afternoon, everyone. I'm really excited today to welcome Amanda Griffiths to the podcast. Amanda has lots of years of experience of social care and is probably one of social media's most popular posters across the industry. So if you want to know what's going on in social care, then follow Amanda on social media. But before I kick off today, I just thought it'd be good to Amanda, would you mind introducing yourself and giving a little bit of a background about yourself?
Oh, yeah, absolutely. Yeah, so I'm Amanda Griffiths, and I've got a lifetime of experience within this industry. I started off, as many people do, within the NHS. I did nurse training. And then when I had my first son, didn't want to go back into the NHS, so took the decision to move into social care. And that was 33 years ago, and I've not looked back. And so therefore, really, I've been on a very long journey, and it's not been my journey. I think it's been the industry's journey, and we've seen so many changes. We are by no means the same organisation, the same industry, or the same workplace that I joined all those years ago. So that's me. The only other big change I've made in my life is that for very many years, I was really passionate about working with older people. And I made a move over to working with adults of working age, and more specifically people with a learning disability, with autism, or with brain injuries. And if I thought I was passionate about working with older people and people with dementia, it racked up another level when I took the move into sort of the arena with people of working age. It felt exciting, it was motivating, but at the same time, it was comfortable. It was like putting my slippers on. So I kind of feel like I'm in the right place, and I just love what I'm doing.
Fantastic. And today we're also joined with Charles, who's the CEO of Florence, and he's also going to be a co-host today. So may jump in with a few questions if you don't mind, Amanda. Amanda, you mentioned you've been in the industry for 33 years, which is a long time. And you said it's changed a bit. So what are the biggest changes in the 33 years that you've been part of social care?
I could probably sum it up in one word: regulation.
Oh, really?
In fact, we could say it in three words: regulation, regulation, and regulation. So just the requirements to do the job and what's expected is so different. If you look at onboarding new staff now, looking at weeks to get a new member of staff onboarded. And I've told many people the story. When I made a decision on a Thursday lunchtime that I wasn't going to go back to the NHS and I was going to move into social care, I got in the car and I drove half a mile down the road and knocked on the door of a care home about 4 o'clock in the afternoon. I was back there at 7:30 that night with the keys in my hand and left in charge. I mean, it's just blue sky, isn't it, between what we see now and where we were then.
Did you have to do an enhanced DBS back then, Amanda?
Nothing. They had no references. I filled the application form in while I was on duty. I had no handover. They literally gave me the keys as the nurse on duty was leaving the door, and I was left in charge of, I think, 37 people and a staff of 6 that I'd never met. No induction, nothing around fire safe, nothing.
You tell that story. I can't decide whether you're telling that story like it's a good thing or something that's a bit scary. Do you think, is it good that happened for you back then, or are we in a better place today?
I think we're probably in a better place. It's probably safer. And so therefore, when I think about what is quality care, I have a very clear definition that I've worked with for years. And that is, it is care that is safe, it's effective, and it delivers a good experience for people. And actually, maybe it's just visibility, and maybe it's because we can access everybody's DBS and everything else. But fundamentally, that wasn't a safe move. I could have been anybody walking into that home overnight. I could have been an arsonist. I could have been anybody, couldn't I? So I think, yes, it is a good thing. I think it's sad the way we've arrived where we are. And maybe that some of the processes, I think what we've done over the years is instead of considering how we change things, we've added things. And what we've ended up with is this mountain of requirements and hoops to jump through. And so, you know, I think it was a good thing, it was a bad thing. But we are where we are, you know, and that's life, isn't it?
So maybe we have, you know, a safer service for our service users or residents. But that last point you made about creating a great resident experience, do you think that sometimes can be lacking with all the regulation?
Yes, because I think if you are not really on top of what you're doing in terms of your internal governance and your assurance processes, and if you don't get them so that they're really slick, they work well and they alert you, then actually you spend your life digging yourself out of a hole. So you have to have a real sense of rigor so that you know what's happening before it pops up like a whack-a-mole and you know, and hits you slap in the face. So yeah, I think it's, you know, I really do believe that we are overloaded with requirements. And I think this pandemic has been a real reflection of that, with so many people, you know, for a small care home provider, I don't know how they are coping with the continual information requests. For a larger provider, there is that opportunity to have dedicated personnel. But if you're somebody who is an owner manager, I don't know how you're coping with, you know, capacity tracker and the GP wanting information and your local authority wanting information. There is a fundamental review needed to ensure that in terms of the processes that support the effective management of social care, they need to be streamlined to the point that they remain safe, that we free up time to make sure that the people we're supporting have a really good quality of life.
Do you think that's going to happen realistically?
Do you know what? I really believe it will happen if we keep making the noise about it. And that's something else good to come out of this pandemic. It strikes me that, I mean, through my experience, I have made connections with so many people that before we were perhaps working in silos. We still have our own organisations that we're aligned to. But actually, in terms of, you know, people working in the same role as me for other organisations, there is an element of cohesion now. We're working joined up together. We're seeing the trade industries really operating on our behalf. So yeah, it's one of those things, isn't it? It gathers momentum. It really gathers momentum. And I think, you know, maybe in a couple of years' time, we may suddenly stop and think we've arrived where we wanted to be. You don't see change overnight. For something as large as social care, it will not happen with a big bang effect. What we'll see will be incremental changes in the right direction. Then all of a sudden, the same way as I can reflect on 33 years ago, we'll stop and we'll think, wow, look where we are. Yeah. And you know what? If we stop having the hope that that will happen, then we might as well all go home. So we've got to believe it will happen. Definitely. And we've got to carry on campaigning and making sure it does happen.
So if you could get Boris or Matt Hancock or whoever in the room and you could ask them for one or two things, what would you ask for?
I don't think I'd want to ask them for anything. I think I'd want to show them, because you can ask and you can say we need X, Y, and Z. But what they really need to do is see what the regulatory and legislative burden is doing to our managers. And they need to see how that outworks into workload for managers. And then we see, you know, we see issues around people saying that social care sometimes is not as good as it should be. Well, perhaps if people weren't running scared, ticking all of these boxes for everybody that measures us, then perhaps we'd have time to focus more on the care and support that needs to be given.
I was chatting to a care provider this week and they were telling us about an infection control audit they have to do every month. And it had 617 questions they had to go through and then write answers for. And that's a small provider, you know, without central teams. So I guess that shows that. And that's just one of their audits. They have lots of different audits they have to go through as well. So we haven't actually explained what you do. I haven't given you a chance. Sorry, Amanda. Very rude. I have said you are the, you know, probably as famous as David Beckham when it comes in the social care sector. But could you just explain to the listeners what you actually do, what your role is, because it is a very big role, and I think it's important to set the scene.
Yeah, so I work as a quality director for a large provider of care and support to people of working age. And that role is quite wide because it covers everything to do with policies, procedures, and, you know, all those things that underpin the delivery of good care. all the way through to how we measure and make sure that what we say we're going to do, we do. So it is a very wide role. And you know, at Voyage Care, where I work, we are a large provider, the best provider, but we're a large provider.
Yeah, I think I'd say you're very large. You're one of the largest, aren't you? So,
yeah.
And previous to this role, you also had quite a long stint in sort of people management and HR, didn't you, as well?
No. So I did that at Voyage. So my background is basically clinical and governance. And I've worked for some of the other larger providers in the sector, spent a long time at Bupa, spent time at Methodist Homes. And yeah, a bit, there have been odd times when I've dipped out and I've done other things. I had a very interesting stint when I had very small children, when I worked as a nurse in a brewery. That was very interesting.
A nurse in a brewery?
Well, so there is a very funny story about that. So I was given the role as the occupational health, as an agency worker, because it fitted in with my family. And after 6 weeks, I couldn't understand why nobody had been to see me. And being in the Midlands and being sort of 20 years ago, life was a bit more, it was nice and genteel. So because I was a nurse, somebody would deliver my milk to the medical centre every day. And I'd walk onto site, and I would walk to the building from one direction, and that was it. I'd go in, my milk would be there, nobody would visit. And one day there was no milk. So I rang up and asked them in the canteen, where do I go? And they said, you need to walk back down in the opposite direction to you normally come, and you'll find the canteen. I went down to the canteen, and when I was walking back, I had that horrible feeling, because there was a notice on the outside of the building coming from the site rather than from outside, with one of those sliding things that said nurse in and nurse out. And I'd never changed it to say that the nurse was in. So I had 6 weeks of cleaning, and that was it. So yeah, I have done odd things because having a family and having 4 kids, I couldn't do what I'm doing now if I'd got the responsibility for 4 children as well. But primarily, you know, I've worked in the private sector, a bit of occupational health, and it's been my life. It's in my veins, I think. It's in my veins.
Very so. And you've never worked for a small provider, it sounds like. What's your view?
Oh, I have, yeah. So the first few places I worked, I used to live up on the Wirral, and I worked for small providers then, back in the early days, and when I've done agency work. So yeah, they are. I think if I look at now what I know around how we provide care and support against what there was that there were a couple of points, aren't there? A couple of pinch points. A, working for a small provider with one home with 20 beds, and doing that 20, 30 years ago, it is night and day between what we see now.
What are your thoughts about how the small providers have managed through this pandemic?
So I am on several forums on social media, groups for registered managers and other professionals. And actually, there is a real sense. I've already said I've had a lot of interaction with people that work in the same level as I do. But I've been very privileged to be part of some of these forums with managers and managers who work for single or just 2 homeowners. What has been remarkable is the collaboration between them. And actually, you will see occasionally on some of the social media groups when a manager suddenly finds out that group's there, and it's palpable, the sense of relief that there are other people there to kind of use as a sounding board, to discuss things with, to make sure their interpretation of the never-ending guidance has been correct. And I think for many of them, and I talk from experience from interacting, and same ways I've shared on LinkedIn, on these Facebook groups, as changes come, you know, you share them, you let people know. But I think it has been overwhelming for some managers because it's been so much. I mean, some days there have been multiple changes to guidance. And if you are counted in the numbers as a registered manager, if you're the nurse in charge, how do you ever free up headspace to just interpret this never-ending stream of guidance that we've had over the last 12 months? And I think it's been very good, you can use it as a standalone. I think it is really good as a standalone document. But actually, the key to really good governance is making sure that everything fits together. Otherwise, you just end up with something as wide as this with multiple processes. And what you need to have is that one core theme that goes down the middle. And it may be that you've got, you know, one set of guidance that you don't need to write an individual process for, but where does it fit with something else? How does it become part of another existing process? And I think, you know, I think what's really fortunate for larger providers is you've got the benefit of working with like-minded people, and you can bounce it backwards and forwards. You can consider, what are the risks? What risks would you want to take in terms of implementing this? What's the easiest way of delivering this? How do we reduce the number of controls? Because again, you just end up with signature after signature after signature to be able to evidence that you've done something, instead of actually turning it on its head and focusing on what are we trying to achieve. And what we're trying to achieve is that we don't have an outbreak of infection. We're not trying to achieve a suite of documents that says we've done everything we can do. And I think, you know, yeah, I wouldn't want to be a small provider at this time, I don't think, without the resource to support. Because I think this year has been a real example of where, I mean, it was hilarity, wasn't it, at one point last year, with every Friday night at 9 o'clock, the guidance would land. You know, we have to think about who our customers are. And everybody needs to think that. And, you know, when the government were releasing all that guidance, so we're not thinking about the customers that were having to interpret that. But that presumption has to roll down to the managers, and they have to think about who are their customers. And for them, it's the people we support, it's their families, and it's their staff. And so therefore, you know, I think it's been the volume rather than the technicality. I think it has been so much.
Yeah, Amanda, I think that's a really, really insightful point. I think probably very, very useful for people listening to this. You know, seeing governance not as gathering signatures, but trying to understand what are we actually trying to achieve. Can you think of an example of how you've kind of used that approach over the last year to a specific situation? I mean, there's probably too many to think of.
There probably are loads. I mean, there is an awful lot that we've to. I don't think COVID is probably the best example to give, because I've been on several webinars lately where there is an awful lot of noise. Actually, this will be the new PPI claims, and that, you know, we will see an avalanche of claims. This isn't just social care. The webinars I've been on, this is about every employer that's had an outbreak in their employment, not just social care. And so therefore, just based on that alone, you know that if it comes to that point that there will be litigation, that you do need to evidence. And I think the key to that then becomes about how you make things more digital, and you make it smarter, and you make it that you're not double entering information. So if you take testing, for example, why would you want to fill in hundreds of pieces of paper to say, this is the test I've done, and this is when I did it, and what this is the result, what the result is? You know, the obvious solution is that you have some kind of an electronic portal that you drop with a drop down, you select the person that you're entering the test for, it time dates, stamps it, and it's done.
Yeah.
I think that's the thing. I think, you know, that's the bit about the process that provides it provides lots of information. If you wanted to track an infection or an outbreak, you could use it for that. You can evidence it individual. You can look at what percentage of people have had testing. You can look at what the exceptions are. So I think that's the point, isn't it?
Amanda, you also, I completely agree with that. You also talked about the burden that's been placed on home managers over the last year, and you know, many people have risen to that challenge. But I think we're seeing now, speaking to, you know, home managers every day, we're hearing these, you know, increasing burden of mental health problems related to some of the challenges that people have been going through over the last year. And I know that's quite an important subject for you. I see you talking about that quite a lot. What's your take on what's going on in the industry from that point of view? What's going to happen next with people's mental health?
I think what happens next is down to government, it's down to providers, it's down to employers, because actually people with mental health issues could occur anytime for anybody. Take a pandemic. I think, like we were talking before about, it's one of those things that it's gathering momentum. You know, over this year, we have seen, as well as COVID, we've seen significant changes in attitude in society. We've had the whole Black Lives Matter. You know, we forget that happened. There's been significant changes in people's attitude. And then we've had the whole thing about, you know, women's rights in the last few weeks.
Yeah.
It is only by the power of people being open, transparent and sharing and not being frightened to do that, that I think we make it the norm. You know, nobody would bat an eyelid if suddenly I had a heart attack, you know, and I didn't post on the social media and then all of a sudden I said, sorry, I've not been here, I've had a heart attack. But if I had some kind of anxiety attack or was diagnosed with terrible depression, the true measure of where we are with mental health would be when people will have the same response.
100%.
And I do think we're getting there. There is much more in social media. I think social media has grown. I think, you know, digital communication has grown substantially over the last year. And we've got to take that opportunity. So, you know, for any employer, it is absolutely essential that we don't wait and say we're going to be really good and we're going to deal with it, but actually we ask the questions and we keep asking the questions until people are really satisfied and understand that they're asking a question because they care and because they can point me in the right direction and not because it's ticking a box.
100%. And, you know, if someone walked into your office and said, I've got some chest pain, you would know exactly what to do or where to send them, right? But, you know, I imagine many people across the country wouldn't be having those kind of conversations. I think it's super, potentially a positive thing that's come out over the last year is just that movement we're making to having those open conversations.
Well, I think you're right. And I think, you know, for somebody working as a support worker or a care worker or a nurse managing a shift, it's become mainstream now. So, you know, if you think of the work that the care app and everything's done, if you go onto any social media portal, if you Google it, if you are looking for care and support on the back of COVID, it is there in bucket loads. And I think it is really important that not only at work, but in our personal lives, because, you know, we've all nursed people through this last year. We've all known people. And I think people have been a lot more open. I can think of many people, not work related, who have said to me at some point, I'm really struggling with this. And actually, you know, the resources are there. And it's another thing that we've all got a responsibility to make this change to our societal attitude to it and how we respond. It's got to be the norm. Any one of us, you know, could wake up one day and not be in a good, I mean, I quite regularly do over this last year. But it is about, you know, we have to know where we can go to get the support, and we have to know what is the norm. If you have a headache, you don't think twice about taking some brufen or paracetamol, whichever one suits you. So nobody dictates and says you have a paracetamol or you have a brufen. People know what suits them. And that's what we need, is a range of options for those mornings when people wake up and think, I can't do this today. Well, you know the options, what works for you. And it has to be the norm, the same as reaching into your bag and taking a paracetamol. That's
100%.
I guess
that's where we have to go.
I guess thank you for keeping it in the public sector, keeping it in the media, and as you said at the beginning, it's not going to happen overnight. So just conscious of your time, Amanda. So I think the main purpose of today was really to try and give to take some of your learnings that you do about how you stay on top of the legislation and regulation changes and how you sort of process them and put them into action on the sort of front line. Obviously you have lots of experience and you have a reasonable sized team to help you. If you didn't have that, I think it would be just good to get some practical tips, if you wouldn't mind sharing, because I think that's what our listeners are really craving to hear, of like, how can they, if I'm a 1 or 2 site provider or even 3 or 4, how do I stay on top of all these ever changing the situation, and how do I make sure that I am, you know, doing all I can to provide the best care and not just provide the best checklist? Any tips you can provide there would be really helpful. Thank you.
Yeah, I think that I often refer to people use those words quality and compliance interchangeably, but they're two different things. And you know something, you have to chunk things down. And the first thing that you have to achieve is compliance. And I often use the picture that actually quality and compliance is a bit like a cooking competition. It's a bit like the Great British Bake Off. They all get the same recipe and then they put their interpretation on it. And the one that looks the best and that meets all the requirements is the winner. So the compliance bit is about the recipe, about the things that you must use. It's about using those ingredients with the right processes and doing the right things. If you do that right, everybody should get the same cake, which is compliance. You're ticking the boxes and you are where you need to be. When you want to step it up a level and you want to go to quality, then that's the bit that's around thinking about who the people you support are, who the people you're nursing or you're caring for, and then making it presentable and acceptable to them. But in terms of how do you do that and how do you get to a point of being compliant? Because actually, if you go onto the CQC website, so I'm talking England here, and you navigate your way to the regulations, and then you click through under Regulation 17, Good Governance, and then you look at everything else that you're expected to meet, it falls into the stuff about the environment, the stuff about the building, there's food safety, there's health and safety, there's moving and handling, there's cost records, there's your DBS. It's never ending. But you can't take a wild guess at it. So I don't think there's an easy route to doing it. I don't think there's an easy route at all. But I think you have to have a very well-constructed process whereby you work through it. You only do it once. I, for many years, have used gap analysis. I've used a very clear gap analysis. I've got a tool that's in an Excel document that now is updated, but it's the same process that I've probably used for 20 years. And so therefore you take the requirements of what the act or the guidance or anything else says and drop it into your spreadsheet. It's a really easy thing to do, and then work through it. You've either got it or you haven't got it, or you've got part of it, and then identify what you need to do. When you've done that gap analysis, because you've broken each individual area into component parts, don't throw that away. Don't throw the baby away with the bathwater, because when you've fixed it all, you take those standards and they then become your audit for checking that you're still doing what you should be doing. So this is what I mean when I say it's about using the same things over and over again, having one core theme. It's really important that you're very clear about what you want to achieve, and you have to be very clear what your goal is. So you have to do the compliance bit, and you have to be very clear what you want to achieve, and about how you get there. You need to make a decision. And I would say for very many people at this moment in time, I almost wouldn't be going down the route of creating. People love forms. Care homes are all about flipping forms. We have paperwork and forms coming out of our ears. When you've done that gap analysis and you know what you've got to evidence, if you're a small provider, and I'm not speaking on behalf of anybody here, but I think now is the time that you have to think, do we carry on with all this paper and what that does to the environment, or do we look at a digital solution that cuts swathes out? You know, it's more intuitive. It tells you when you're not doing things. And I personally would find that really difficult if I was sat as a small provider, having done everything in paper, and probably offices and filing cabinets full of paper. But over this last year, it's become really evident that we need to do things differently. Really important. And you know what? I've got nobody to recommend, but there are so many people out there as a small provider who are offering the opportunity to turn your care home world into digital. If I were a manager in a one home service, I would be looking at returning to normal after this pandemic and coming out of the other end in a much more digital solution. It's the way it's got to be. I do believe that.
And where would you start? Which one? What would you do? I mean, you could do HR records, roster management. You could do care plans. health and safety audits? Where would you, obviously you can't do it all at once. Where would you?
You can't do it all at once. So and this is why I said before, you need to be clear what you want to achieve. Now, there are many things I've dragged through 33 years. In 2008, the Department of Health did a review around quality care in the NHS. And they defined quality care, and I've kept it with me for 13 years. They defined quality care as being care and support that is safe, it's effective, and it's a good experience. And the thing at the top of that is the safe. So you need to understand, what do you need to do to be safe? So do not go, planning how you're going to measure, is the place clean, if you've got bed rails that don't work and you've got medication administration. If you've got those areas, it's got to be safe. So everything to do with the people you support and your staff being safe, you address first. Because if you don't keep people safe, you've not got a business. I think after that, you look at how effective is what you're doing. Because there's that thing around, I could keep you really safe, but actually you don't ever achieve anything. You never go anywhere else. You just stay safe in a cocoon, in a bubble. So then you need to look at how effective you are. And I think that being effective and that efficiency, again, looks at everything from management through to care, through to staff management, and put the experience bit at the end. Because something that's been really evident through this pandemic is there's been so much noise about the lack of visiting, and that's about people's experience. People have not had a good experience. But you know what, that has been done with those principles to keep people safe.
Awesome.
It kind of marries up. There are many things you can do in terms of your staff. A staff file audit, just go onto the CQC regulations, go into the schedule at the back of the legislation. It's documented in bullet points. That's what you need to do. I often say to people, don't dive into analysis paralysis. You've got to be agile and you've got to get on with it. You have to set yourself a bare minimum, the minimum of those standards. When you've got that in place, move on and make something else safe. When you've got all that done, then you can come back around and decorate your cake.
How digital are you at Voyage, and what are you working on at the moment, if you can say that?
No, I can say that because it's what's out there. So we know that CQC are changing the way they're going to be operating. So we're following that very, very closely. And if I reflect back on what we said about gap analysis, the National Institute of Clinical Excellence very kindly in the last few weeks have landed a whole new guidance document around safeguarding. So straight away, the approach I've said to you, it is just second nature now. And actually, that's a really good point to say to you. If you go onto the NICE website, there is best practice guidance for many areas of social care. And the nice people, if I put it like that, people, if you look on them more, so if you were to look at the one on safeguarding, there are 244 new standards to be met somewhere in that region around safeguarding. If you take the time to read and see what's on that website, if you click through the tabs, there is an even better gap analysis document than I've ever had. It's there. The standards are in it, and managers can use that to assess how compliant they are and are we doing what we should be doing. You cannot run a care home in isolation from everything else that's happening. You need to align yourself to very many different groups. You need to make sure you've got support. Really simple things. Set up Google Alerts. I've had many people say to me, how the flipping heck do you know that guidance has changed? Well, the minute I figured out what was happening, I set up a Google Alert, and the minute it lands on the .gov page, it's in my mailbox. You just have to be smart on these things.
That's a great tip. We always thought you were a Russian spy, to be honest.
No.
So some practical tips then, just to recap. Google Alerts, look at the government website, the NICE website, the CQC website.
Yeah.
Obviously, it sounded like you get a lot of benefit out of talking to other providers. So I guess if you can create a network.
Absolutely. If you have, majority of areas will have regional care home associations. Don't ever miss out on those meetings. They are, over the years, I've belonged to many in different areas. Get yourself aligned to them because there's a sense of sharing the load as well. So, you know, if you're in a managers group for, I don't know, I'm in South Derbyshire, if they've got one in South Derbyshire or in Derbyshire or wherever, get yourself involved.
Yeah.
Because all of those key things that are important and that you need to know about will be on their agenda, because they will make it their business to have it on their agenda. Really important, because the problem is you only know what you know. So, and as we identified, everything changes so quickly in this world.
Amanda?
Yes?
Sorry, I interrupted you there, Amanda. I was going to ask you, actually, lots of people doom and gloom about social care, but what are you optimistic about?
I've always been optimistic about
You're
it.
a very optimistic person, but what about the sector?
I am holding out real hope that we will see a fundamental review of what we do, and that we will see. The problem is, I think that the fact that it is underfunded as a sector, to my mind, I see that as a discrimination anyway. And I think that, you know, for people that live in a care home, and especially now working with people of working age, they're entitled to the lives we've got. But if they're not funding people to have those lives that we've got, everything we do, they should be entitled to. And so therefore, I am really holding out hope that this has shone a light on social care and that we will see those changes happen. And we've all got a responsibility to keep making a noise about it. We've all got a responsibility.
Fantastic. And just the last question, if it's okay with you, any final tips or advice to people thinking of making the move from maybe the NHS into social care, or someone thinking about becoming a home manager, maybe yourself a few years ago? What would be your sort of top 2 or 3 tips that you've learned over the last 33 years?
I think that the industry is ready for people to make that move from the NHS. I don't know whether you cottoned on. So we've had Deborah Sturdy appointed as the chief nurse for social care. My God, 33 years we've waited for this. The minute that was announced, I DM'd her and said, I'm so happy. I haven't got a problem. I'm on there on my keyboard. This is important. This is important that we get the recognition. We have been the poor sister or the poor brother to healthcare. But yeah, I think there are many organisations, there is really good career progression. You know, the options for training and development are there. It isn't a dead end job. And I think there is a perception in our society that working in care is a dead end job. It is the most rewarding thing that anybody will ever do. It is an incredible privilege to work with people. And I just think that, you know, I do believe that we are on the cusp of something special. We're brilliant as it is. I have to say, as an industry, we are brilliant anyway. It's just sad that it's the negative sometimes that hits the press. But, you know, like I say, I've talked to many people, and some of the things that have been happening in care homes and care services across the UK have just been phenomenal over this last year.
Well, Amanda, thank you very much for all that you do and for your generosity in providing information and support to people. And, you know, we all definitely hope that what you believe and you hope to come true will come true. So thank you for your time, and have a lovely weekend.
Thank you.